Hi everyone, Dr. Raval. Welcome to Doc Dynasty, and I'm thrilled because this month I was interviewed by Becker's Physician Leadership on what is missing in medical school. So I want to reiterate some of the things that I've already said and a few others that have commented on this question. So number one of the comments, Dr. Corbett, who's former medical officer in Utah, said, number one, integrating AI into the medical curriculum. So what's happening now is with the access to AI, there can be less memorization and regurgitation of data and information that medical students have to know for their board exams and know to treat patients. In other words, we have the power of AI right on our phone. So it becomes more and more important for physicians to learn how to interview a patient, how to find out past, present, and future possible symptoms. The power of a good medical history will help us solve some more medical issues as they come up in the future, and more complicated issues, because you can literally take some of those words, put them into ChatGPT, and use AI to come up with a more particular differential diagnosis. So whereas we always, going through medical school, had to memorize all these things and hope we could spit them out, instead we can use AI to filter through a good medical history. So I think it's a very valid point that the art of medicine is not about just memorizing all these facts and regurgitating them for the boards, but rather it's a way of practice that becomes more patient-centered and getting better medical history. Good point. I will say I love also a focus by Dr. Ortega in Long Beach, California, who also broke down how business classes should be part of the core curriculum in medical school. I cannot agree more. It is absolutely missing. He breaks it down into 6 items, which I am going to share with you here because I think it's so important. Number one, contract negotiation. Medical students are coming out of their residency programs and fellowships 6 years out of medical school, some of them, and do not know how to evaluate a good employment contract. They're looking at all these contracts and saying, what's good for me? No way to analyze them. We absolutely need to know what a red flag is and what we can negotiate. In my opinion, everything is negotiable. You have to make decisions for your own future based on your education. Number 2, billing and coding. This is often done through the hospitals as we train. It is very important that you know how to bill your services accurately and what you're getting paid for those services. It helps you build a better contract, but if you go into private practice, it is critical to how you survive. Insurance, billing, and how you're reimbursed, kind of related. Billing and coding, billing and reimbursement. Important, even if someone else is doing it for you, how your services are getting paid matters. This is your future. This is your future employment, and it determines how you get paid. Fourth, how health systems make money. All right, so a lot of focus on private equity now and how they're making money off of physicians. It's very important that you understand how insurance companies, private equity companies, large physician groups make money off of your services. Physician managers can easily teach this class so that, again, you can better evaluate your services and how they relate to a practice. Basic financial literacy, debt management, accounting, how to plan for your retirement from day one, what are good investments for physicians, absolutely important. And lastly, leadership and practice management. I've talked a lot about this. This is one of the reasons I was probably interviewed for this article as well. How do you transition from day-to-day practice into a position of leadership. Traditionally, a lot of physicians go into leading their residents or being a residency director. There's more to it than that. We are definitely should be taking the lead instead of a PhD on how a hospital is run, how a equity group is managed, how large groups are managed. Physicians should be moving up to that position because they have real life patient-centered skills. So I couldn't agree more with these 6. I have personally added a few other things. I added, besides basic accounting, I added practice management. You need to know how to run your day. You walk in, patient comes in. In our practice, we have made it 15 to 30 minute visits. We have done everything in that visit, meaning we have filled out the paperwork, seen the patient, treated the patient, gotten MRI, X-ray if they need it, and they then leave the office. You have to know how to run your day to be efficient. And you should be practicing that within your residency program, how quickly, efficiently, and effectively you go through your day. I also added you should know practice software, not just the ones that you're learning in your residency program, but when you come out, you need to look at different practice software and what might work more efficiently for your office and the costs involved with that, even if you're working for someone else. And lastly, you should have how to build a business from scratch. Whether you're doing it now or you have the option to do it later, you need to know how to build a business from day one out of your practice. So those are the 3 things I've added to this discussion. Happy to hear from all of you on what your thoughts are. I think we all agree, whatever you do in this in the business environment, medicine is about the patient. And I think it's very important we don't lose that focus. Welcome and stay with us.